everybody. We are here with Dr. Sharon Dickerson, and she is a biological dentist. She has been a biological dentist for over 30 years, a dentist for 35 years, and she has an amazing story that I would like her to share that with everybody because it has a beautiful end. It has a is a success story. Hello, welcome.
Thank you. It's so nice to be here. Yes, and we all have a story. And it seems like in biological dentistry, almost everybody I know that gets into it got there partly because of a loved one or themselves, their own health, maybe a patient. But in my case, I was oriented towards a holistic view of life, even with my parents. My father was a dentist. We worked together for many years. He and mom were always on the latest health kick. Kind of during the 1970s, there were a lot of people very interested in organic gardening and health. But when I hit some health problems, I was a young mom and I had very significant chronic fatigue and what was diagnosed as fibromyalgia, just a lot of pain throughout my body. And it was not, well, I couldn't get it treated with just medications. So I kept looking. And I found more of a functional medicine approach at a clinic in Michigan where I was practicing in Grand Rapids. I'm going to shout out to the Bourne Clinic because they're still in existence. And they kind of gave me my life back in the late 1980s, early 1990s, when they did some more testing and discovered that I had a lot of heavy metal toxicity in my body, especially mercury.
Wow.
So I grew up in this dental life, this dental family. My father didn't place a lot of mercury fillings later, but in the early days, it was everywhere. And we would go down to the office and literally play on the desk with the mercury because it's such a cool material.
Yes.
And I started working in his practice when I was really young. And anyway, then in dental school, you just are dealing with the mercury amalgam the whole time. And I think it all added up. Plus, there are other sources of mercury in our diet, and at that time there weren't super great gentle ways to get rid of it out of your system. So I went through a process of chelation, and then just launched into a whole health perspective. That ultimately we have better testing now. We have easier ways to make sure that the detoxification process is healthy and gentle enough for everybody to be able to tolerate. But I was able to get through that, and I just felt so grateful. But then my big question was, so I have gotten it pretty well cleared out of my body. How am I going to not get continuously exposed? Because even though I wasn't placing mercury fillings, I was removing them from people's teeth all the time. And it gets in the air and you're going to breathe it. And I didn't want my patients to be exposed once I learned the problems with it. So that's when I got involved in holistic or biological dentistry and learned the process for the safe handling of that material. And then once you start collaborating with dentists that think that way, there are many other facets to it. And what other materials are used in dentistry that could have toxic potential? And how do we protect ourselves? How do we protect our patients? So that really just launched the whole biological aspect of my practice as a dentist.
Perfect. So then the symptoms that you were having were not really the fibromyalgia. It was more that toxicity that you were having with the mercury, the accumulation of this heavy metal in your body. Let's explain people a little bit about what chelation is, because a lot of people don't know about that.
Yeah, chelation is a process that can be used to remove various toxic materials from your body, but I know it's used especially with heavy metals. And it's usually provided through a medication and an IV that binds these chemicals, these elements in your blood, and then you kind of have to flush them through your body, through your urinary tract, through the bowels. So that's actually leads to a part that I think some people get too aggressive with it, at least back in that day, because some people don't have good function with their bowels or their urinary tract. And so the chelated materials get kind of running through the bloodstream and really don't have an effective way to be excreted. So then some people can have exacerbation of their symptoms. Things get worse. So I think we're so fortunate now to have great functional medicine practitioners that can help patients make sure this is all done in the right order, that you have good excretion pathways, that once you decide to try to clear your body of these chemicals and these elements, that you're going to be able to rid your body of it cleanly and safely without making your symptoms worse. But the crazy thing about mercury is that it tends to become embedded in so many different cells in your body, including brain cells, eyeball cells, hair follicles. That's why one of the ways they can test for mercury toxicity is by hair samples. So yeah, it's a tenacious element to try to clear, but you can do it, and it might just take some time, and it's not going to be fast
Exactly.
if
How
you're
long
doing
did
it
it
correctly.
take you to get
I
completely?
worked at it for a couple of years.
Mm-hmm, mm-hmm. And
Yep.
what do you do now? For example, for patients that are going to have their amalgams removed, is there a protocol that you have, or you just send them to the naturopath? What is your process?
So it's interesting as you grow and develop and you treat various patients and thousands of patients over the years. I've actually gone more toward, since we have such great practitioners now in functional medicine, integrative medicine, great naturopaths, everybody's health status is unique.
Mm-hmm.
So I really would like their collaboration on this particular patient. And so sometimes people's general constitution and health isn't too compromised, and they're ready to go. They just want to get the toxicity out of their mouth. And their physicians and their doctors and their naturopaths are saying, yeah, go for it. But other people, gosh, we really need to stage this, and we need to check in with um, how your overall health is doing and make sure we don't cause a further problem. So I defer more than I used to. There are definitely protocols for preparing the body and different things to bind the mercury that might be released during the procedure. There are lots of those out there, and I'm sure they all help.
Mm-hmm.
But I really just make sure we have safe protocols so that the exposure is minimized and that this patient is healthy enough to sustain whatever minor, I guess, um, sort of exposure that they might have during that process. So, yeah, that's kind of how I approach it now.
Correct. So and
Mm-hmm.
we are all different. Not
Yes,
one person is the same as the other one. And they could be exposed to mercury just the same, but they all are going to react in a different way.
exactly.
That's why having the consultation with the functional medicine doctor, a naturopath that knows what to do with heavy metals, how to detox the body. And then when
Yes.
you're going to do the removal, don't do all of them at once.
Yeah,
Just stage it.
right.
Hmm. So now I want to talk about something that you have been working with for many, many years,
Mm-hmm.
which is the occlusion,
Right.
balancing our occlusion, the bite, the TMJ, and maybe just patients that are having problems with bruxism, grinding, clenching. And you have discovered something that is even deeper, that is my passion, and is how our emotions communicate with what we're experiencing with our mouth. Can you please explain a little bit about what you do, what you have found, and
Yeah.
these amazing results that you're getting, not only at the physical level but also at the psycho-emotional level?
Yes. Thank you. That is a huge passion of mine. And again, we don't have enough time in this interview to talk about my own story with that, but I have a very intensive story for my own dental history, my own bite, my own TMJ. But then that is, I think, part of why I was so interested in learning more about it. And so I went through a lot of searching for why are some people really destroying their teeth with grinding and clenching. Other people aren't. It's not related just to stress. That's sort of a common theme that you hear people are told by different practitioners, that it's just you're grinding your teeth because you're stressed. You need to get control of stress. Well, certainly stress will make anything worse in your body that is already an underlying problem, of course. But what I learned over a lot of different years of training is that usually when people are having destruction of their teeth or chronic pain with their jaw, chronic headaches, it often can stem from an imbalance in the way that their jaw fits and is functioning and how their bite is functioning. And when those two critical parts of our function, our breathing, our chewing, our speaking, are out of sync with each other, it can create this chaos that I feel is at the root of many of these habitual problems like grinding and clenching. So ultimately, in my training, I landed on a process notably called orognathic bioaesthetics. International is the teaching modality, but in practice, it really has a philosophy of stabilizing this relationship of the jaw to the base of the head through the jaw joint. And there's a certain protocol we use for that. And when patients have, for the first time, many of them in many years, a feeling that they bring their teeth together and it all hits in synchrony, and it actually has a vibrational effect throughout their whole body at many times that is healing. Because when it's out of sync, it's a constant struggle. So when the relationship between the base of the head and the jaw is in harmony, it's not at war with how the teeth are aligned, that brings oftentimes a decrease of pain for sure, and just sometimes can have widespread effects throughout the whole system in terms of how patients feel. But there's an appliance that helps us do that, and then it usually people need to have something done to restore the teeth that have typically been damaged or weren't probably in a good form in the first place, or maybe they wouldn't have had this problem. So that's been something that's been a huge part that actually goes in really good synchrony with the biological side, because it's both of those things are looking really comprehensively at the whole person, at the relationship of their teeth and their jaw joints to their total health. So yeah, that's kind of where I've come to with it, and that's a huge part of our practice
Is
actually.
incredible. And a lot of the times, and that's one of the biggest reasons why we recommend people to have, have an appointment maybe with a chiropractor or
Absolutely.
just check, make sure that your hips are not imbalanced or your posture is not okay, because it will definitely affect the TMJ or the
Yes.
temporomandibular joint. Then you have found that there is a something really interesting that you mentioned about what it is that we can find in our jaw joint that
Hmm.
is highest when we clench or grind.
Yeah. So the TMJ has an immense amount of receptors for, just as one example, for estrogen. So we notice that temporomandibular joint (TMJ) patients, it's a higher population in females than males that have that condition. And I'm not sure there's all the data yet on why that is, but um, it's not a female disease. It's just that there is an actual hormonal, emotional, um, I guess, connection with the jaw joint and how the jaw joint's working with the entire body. And so, yeah, I have found that when somebody is out of harmony in that relationship of the jaw, it's really hard to be at peace in general, because it's not like you can get away from it. It's not like you can not speak or not try to chew or not breathe. You have to use this part of your body. And oh, Dr. Perez, you're absolutely right. We are so blessed now to have providers that can help us, because it's not just a isolated area of the body. It's going to be connected to the entire cervical spine and all the way down the spine and the shoulders and the neck. And you know, if people can have practitioners that can be in alignment with our treatments and work side by side, it can really be profound. I kind of think of it as an unraveling of this, um, almost like a tension throughout the whole system that, I can control. I'm a dentist, so that's the part that I can help. But it's not just about this area of the body. That is, our training, our specialty. So yeah, that's something that is part of why I ended up moving to the Denver area, because there's such a real focus of total health in this community. I know there are in other places of the country, but I found it very, very exciting to work with various chiropractors, people who do craniosacral work that can be very profound help for us, um, people who do energy healing, people who can help patients who have this kind of tension locked into their bodies. Um, we can control the part we can control, but I love working as a team with these other practitioners because that's where I feel people get the most profound benefit.
Correct. And unfortunately, a lot of dentists don't know about this. And for example, the majority of people or majority of dentists, conventional dentists, they say, "Oh, you're grinding. I'm going to give you an iCard."
Right.
And that can make things worse.
Mm-hmm.
If you're not balanced, if your TMJ is not where it needs to be, and then you're
Right.
putting a device that is not doing the right thing for your job, it can make things worse.
It can, and if even if it works well, it's a band-aid.
Mm-hmm.
It might help eliminate some tension or some damage that might occur during sleep.
Mm-hmm.
But then most people take it out during the day, and the same problems are still there. So yeah, that's basically what I was taught in dental school. Probably you too.
Yes.
Um, and a well-made custom occlusal guard for nighttime can be a great help to a certain point, but it's not meant to be corrective.
Correct.
It's
What
sort
do
of,
you think about upper or lower mouth guards? Do you recommend?
I find that an upper appliance with real allows me the ability to control the function of it much more clearly.
Mhm.
In our bioaesthetic training, we learn about an appliance called Imago. It's an acronym for a much longer name, but the way that the design is on the Imago to me has been extremely helpful. Probably the best tool that I've found to be able to just control the bite forces and make sure that the forces are controlled by putting the guidance of the jaw towards the front where it is in natural unworn teeth. And so, yeah, I've used so many different appliances over the years, many, many different designs, but what I've found is most predictable in my hands and most of my colleagues in OBI is the Mago appliance.
Oh. One of the things, so for how long do you usually have, or the patients usually have this appliance?
When somebody's endeavoring to actually do corrective change, they're going to be wearing that appliance full time.
Full time.
So, yes, all the time. They have to take it out to clean their teeth. But that's when we actually start to make changes. But it needs to be meticulously adjusted regularly. We usually have people coming in weekly. And we're making fine tuning adjustments to make sure that the forces on that appliance are completely balanced. And then as the muscles relax and the jaw joint can shift to a little more natural position, the appliance needs to be adjusted because this has changed. And so we keep refining it and getting closer and closer to stability. And we have different metrics and parameters we use to gauge when is this relationship between the jaw and the head stable, meaning it's not changing. The patient's usually feeling better. We have some ways to measure that it's a stable position. Then we can actually diagnose the bite, the occlusion, and decide what needs to happen on the teeth to solidify this balanced relationship.
Correct. And then,
So it can be, you asked about timeline, and it can be a few months and it can be many months. It kind of depends on how much inflammation's in that joint, how damaged is the joint, how many other factors in the cranial base to mandible relationship are there. So it can vary.
And you were mentioning also that you work in different phases. Can you please
Yes.
explain a little bit about that?
Yeah. So the thing I love about starting with somebody new is just this discovery process of their history, what's happened to them, where are they with their health. Sometimes the first things we do are just, gosh, it seems like maybe you could really use some good support for your total health, help get your inflammation down, help start feeling more energy. And then, assuming that they have that in place, I have sort of one of my first phases is, of course, removal of infection, removal of that would include decay or gum disease or infected teeth. You kind of have to clear the field before you can start rebuilding a wonderful environment in the mouth. So detoxification and clearing out infection is often phase one. And so many times people are having their mercury amalgams removed and replaced with biocompatible composites at that time. There may be some infected teeth that need to come out. That would come oftentimes in that first phase. And then if it turns into being a bite restoration, it's a good time then to start stabilizing this whole relationship of the jaw and the jaw joint. So then they might get into amalgam therapy, and then we start rebuilding the bite in, and again, using biocompatible materials. A lot of times we're doing it in the most minimally invasive way. I use a lot of composite resin buildups on teeth to form the new bite versus other ways that can be very nice, which is grinding the teeth down somewhat for porcelain restorations like veneers or crowns. Every chance I can, I try not to damage that person's natural tooth structure as much as possible. And then sometimes we are using ceramic implants in place of teeth that they've lost, and those can come into this phase. So we're going to detoxify, stabilize the system, and then rebuild it. And it kind of reminds me a little bit of how you might approach if you're going to buy a piece of property and build a new home, because you really need to clear the site first. And so you're going to come in and bulldoze the site, level it out, clean out the anthills, clean out the rotten stumps. You kind of have to get starting with a good, even platform that's healthy. And then you can start laying down the foundation and then building things. And then really the icing on the cake is that typically at the end of this, and a lot of my patients don't even start with this as a priority, but when things are healthy and in harmony, they look gorgeous. So people usually end up with this beautiful smile. That is, you would think that might have been their first priority. For some people, it is. But a lot of people, it's sort of an end result of just coming to health and coming into balance. So that's kind of how our process goes.
Beautiful. And do you have a story where you transformed someone's life, not just because you helped them with their teeth, but it was more, it was a transformation at their emotional level as well?
Yeah. This is such a great question, and sometimes it's hard because then my mind starts going to so many people I've known and loved and cared for over the years. But one of the first ones that comes to mind is a young mom that I met. It's about 7 years ago now, who is just this really amazing woman, and she had already a couple of children, but she was having chronic problems with her jaw, and she was having chronic headaches to the point that she was having even dizziness. She was having trouble with functioning in life, the headache, the chronic migraines. And she came in with her husband, who had to drive her because she wasn't functional enough to drive herself. And they had a toddler that would often come with them, and she was very pregnant at the time. And she was really desperate to get rid of, to improve this problem because she had another baby on the way. And she was already very tapped into her health on a holistic level. But we all have different layers that we need that can be helpful to uncover. And lots of people start with just eating a cleaner diet, getting into organic food, start using essential oils instead of instead of over-the-counter ointments and medications. These are great places to start. And I would say this young lady, Sarah, was already well down that path, but she was struggling. And so we had her start in this Mago appliance. And she came in for her weekly adjustment a week later, 2 weeks later. And on week 3, she came in and she didn't have her husband with her. And I said, well, where's the family? And she said, I could drive myself now. I'm feeling so much better. She had a very severe problem with her bite that started a whole new layer of her healing when this part of her body was no longer in such a chronic state of chaos and contraction, and it was causing all these headaches. So in her case, it was really beautiful because she kept wearing her appliance religiously. We adjusted it. She kept feeling better and better. And then about 2 weeks before her baby was born, we sat down and did her restorations on her teeth. I don't know how she did it. She laid in the chair while I meticulously added this composite, gave this form on her teeth that acted like her Mago had been acting. And then she had her baby, and then she had the ability at that point to think straight and start even going deeper with her own functional health. And their family is very on board with total health. She has since had 2 or 3 more children. I get to keep in touch with her when she comes in just for her annual checkups. So that was one of them that really stands out for me because a lot of these people, you can just tell they're talented, intelligent, wonderful humans, and they're stuck in a problem that nobody's been able to help them with. And I'm not always the final answer. I'm not always, of course, none of us are. But when you can add a piece that's so critical to their functionality and to their health and how they feel and how they can work and play and enjoy their relationships and loved ones, I mean, I just don't think there's anything better.
I agree.
Yeah.
That's a beautiful story,
Thank
especially
you.
because a lot of people struggle with similar symptoms and brain fog and fatigue,
Yes.
and they cannot function. She couldn't even drive.
No.
And if they go to the doctor, they start doing all these tests, and usually the majority of the results are there. Everything is within normal limits.
Exactly.
But the problems were, in her case, were in the jaw. Just
Yes.
by aligning her and just balancing and just correcting this disharmony, then
Yeah.
she was able to thrive and be healthy and think straight.
Be a mom and have the big family she had always wanted. And yeah, and what I noticed with that case is how important it was for her to have the support from her family. Not everybody has that, um, but her husband would do anything to help her feel better. And that emotional support, who knows what he actually thought and felt, but he didn't tell her he thought she was crazy.
Exactly.
He told her, I love you. I want you to get better. Let's keep looking.
Yes.
Let's keep going until we find what's going to work for you. I mean,
Find
that's just
the root
amazing.
cause, because this
Yes.
was her root cause of all
Yes.
the issues. Oh,
Yeah.
this is amazing. And there's many stories. I'm sure that there's many stories like this. So what
Yeah.
we want is for people to understand that you need to go and look deeper, and then just we are very complex being. So you need to just
Absolutely.
look at all the different angles to be able to find the cause of the problem. And yes, a lot of it is emotional. A lot of it is psychological. And
Yes.
by correcting the occlusion, everything in her life probably changed. Her emotions, her
Yes.
psychology, just her self-esteem even
Hmm. Yeah.
probably improved.
Yeah.
It's so beautiful. Are there any like tips that you want to give people to take away, like recommendations that you usually think that those are the most important ones to be able to achieve health and well-being, not only oral health?
Yeah. Boy, lots of people can kind of go through their checklist. I think, of course, the best nutrition that you can afford is huge. Um, We live in a society that has a way of agriculture that can include a lot of toxic products and materials that add to our total load of stress in our bodies. So the best nutrition you can find, everybody has a different philosophy of how to eat, but I just think being mindful of that. I'm becoming more and more aware of the importance of good sleep. That's something I'm working on myself, and that's a whole nother story, but it doesn't come easy to me, and I have to really make it a priority. Good sleep, community, gosh, all these blue zone studies and more studies of happiness and well-being and health. So much is almost totally dependent upon having a sense of community, friends and loved ones and people that you have relationships with that are meaningful, that you can rely upon, that you can laugh with and enjoy life. And sunshine, exercise. It's, I'm in the office all day. It's a deliberate, conscious effort to make sure that I have exposure to sunshine. And I think a lot of us just need to remember that it's not necessarily natural to us to be indoors all the time and in front of a computer or just meticulously working over our projects. And then aligning if people are having a downside in health with people that philosophically are in alignment. So Western medicine has so many wonderful features and things that it can do for people, and orthopedics, and I mean, it goes on and on and on. But a lot of people who are dealing with chronic, different, maybe mystery illnesses aren't always finding the path to health through traditional Western medical approaches. It's so then that's why I think the world is just awakening to this, and there are so many great providers in naturopathy and functional medicine and integrative medicine that have a different perspective of looking at your whole self, looking at your digging deeper into your blood chemistry, looking at your lifestyle, looking with you at how to optimize your particular health. And this is where it comes to the big crescendo for my life, which is so many of these practitioners are now acknowledging the critical importance of your dental and oral health. So when a patient is in a state of maybe not being real well, they're trying to work through it, and they're taking care of their supplementation and their nutrition and their lifestyle and their sleep, and they're having trouble getting over the hump. So many more practitioners now are saying, have you looked closely at what's going on with your oral health? Do you have latent dental infections? Do you have root canal teeth that aren't healthy? Do you have materials in your mouth that aren't supportive of your health? Are your gums healthy? I have found, just because that's my field, so many times that's a missing link. Mm-hmm. And in fact, many people are now discovering that dental issues can actually be a root cause to chronic illness. I just really appreciate the work of people like Dr. Tom Levy, and his book, The Hidden Epidemic, if nobody's read it, is amazing. And he claims and he shows, in his opinion, that the majority of heart attacks and breast cancers are caused by latent oral infections. It sounds like a stretch, but if you read the information that he puts out there, it's almost irrefutable that there's a huge connection there. So.
Correct. Oh my gosh, those are amazing pearls. You just said it
Thank you.
perfect, because everybody should do what you just said and follow it to be able to have health and well-being. And one important thing also is just how we think.
Boy, that's so true.
Just thinking positive and just be aware of your thoughts, because they can change your life as well.
Yes, control it. That takes work too, doesn't it?
Constant work.
Yes. I'm so glad you said that. That's like a huge focus of mine right now, is digging into different meditation practices that can help kind of displace maybe old beliefs that haven't been serving me well, and really replacing them with positive picture of the future and positive energy of what's in place right now. And I think that the control of our bodies by our mind and our spiritual outlook is so profound.
I agree.
Yeah, thanks for mentioning that.
Yes,
That's
no.
huge.
Thank you so much. I appreciate you being here, sharing your wisdom. That is super important for people to just learn a little more and just get information, find some answers, go deep and find that root cause of the problems that they're experiencing. So thank you so
Yes.
much.
Thank you for your work and bringing these I guess important topics out to people. And in our field as dentists, I think we have um, a unique ability to see literally a window into people's bodies, and so we're trained to help with that. But those of us that are really thinking beyond our training as dentists into the total body health, um, I think the momentum is building, and it's really exciting to talk with you and people like us who are on the forefront of this, because it's I think going to help a lot of people.
I agree. Thank you so much.
Okay.